policies and procedures for Escaree Nursing Home are compiled following the regulations from HIQA and also the Health Act. These are comprehensive policies. They are situated in folders behind the reception desk. Each policy needs to be read and a signing sheet must be signed to state that you understand what you are after reading. HIQA stands for the Health Information Quality Authority. This is a governing body that oversees and ensures that we maintain high standards for our residents at all times. We have announced and unannounced inspections, and these can last from 1 to 3 days. There are a number of aspects to the HIQA governing body, and there are a number of notifiable events. All of this information can be seen in more detail in our policies. Confidentiality, data protection and social media. In our line of work, I expect everybody to be professional at all times. Therefore, confidentiality is key. This includes protecting each individual's data, whether that be a resident or a staff member. And this also needs to incorporate social media and any use of social media, whether it is within the company or privately. Residents that come to stay in Escaree Nursing Home, they may come to stay for short-term or long-term care. Short-term care may be because after surgery or for some convalescence where they need further medical assessment. Long-term care may be privately or under the Fair Deal scheme, which is a government-operated financial support scheme. Number of our residents, their age group spans from mid-30s to late 90s with varying needs. All residents that come to Escaree are pre-assessed to ensure that we can meet their needs in all aspects of their care. At the beginning of each duty, a comprehensive handover is given from one nurse to the next nurse. This handover includes a holistic approach of each resident, which will include information from the multidisciplinary team as required. Here at Escaree, we use a priority handover sheet. This sheet is set out to guide the nursing staff as to prioritise the most important things that need to be outlined and looked at, followed up on their duty. For instance, if a resident has a fall or a slip, the next of kin needs to be informed. So if it happens at 3 o'clock in the morning and the resident is safe and uninjured, the next of kin will need to be contacted the next day. Therefore, the day duty nurse, it is on their handover sheet to follow through with this. All of our admissions are pre-assessed prior to coming to the nursing home. Within the admission procedure, it is a comprehensive list of things that must be completed within 72 hours of admission to the nursing home. Discharging a resident back home to their own setting, there is a comprehensive list that must be completed to ensure good communication with the community multidisciplinary team. Care planning and assessments of residents within Escaree. Following admission, residents' number of mandatory assessments are compiled and completed. The information gathered from these assessments will then be used to compile care plans. Here in Escaree, we use 4 main care plans. One, This Is Me, which is a holistic view of the person, their needs, what they like, what they enjoy, how they like to dress, the makeup they like to use, whether they like tea, coffee. It is very detailed. All of this information will not be gathered on the first meeting of a new resident. However, it will be compiled over a short period of time and can be added to on numerous occasions following that. Number 2, the risk care plan. The risk care plan needs to comprehensively outline each of the risks of that particular resident. Their falls, their nutrition, whether or not they're a smoker, whether or not they can have a lighter with them. This information will be gathered from the various risk assessments that you will have compiled on each individual resident. The other care plans that need to be included is medication care plan and also end-of-life care plan. The end-of-life care plan needs to state the resident's wishes and preferences towards the end-of-life care. The medication care plan needs to document, for instance, if a resident is prescribed a PRN medication, for example, for anxiety or agitation. You need to state within this care plan the exact parameters as to when this medication must be administered. All accidents must be recorded. In Escaree, we use an Epicare system. For instance, falls, slips or trips must be recorded on each resident. It is very important to note that the resident must be assessed as for any injury. Whether or not there is an injury, the GP or out-of-hours doctor must be informed. A set of observations must be completed and close observations maintained on that particular resident. The next of kin must be informed. It is vital to note that if there is no injury, the next of kin can be notified at an appropriate time, maybe the next morning rather than the middle of the night. The Stratified Falls Risk Assessment must be completed after each incident. Following completion of this risk assessment, the care plan must be updated to reflect this information, and also a referral to our own physiotherapy to ensure that they are reassessed. Where it is necessary to transfer a resident to a hospital setting for medical treatment, it is vital that a number of points are completed. A comprehensive transfer letter, a copy of the medication cardex are sent with the resident. Also, an overnight bag. It is of the utmost importance that the next of kin is informed immediately upon transferring of any resident from Escaree to a hospital setting. Following the transfer, it is also important to continue to liaise with the hospital on a daily basis as to continual updates on that resident. Pressure area care for a resident is of the utmost importance. Prevention is much better than the cure. It is so important to continually assess and adapt to a resident's changing needs. For example, a resident who may normally be mobile and able to turn themselves in the bed may become unwell to an infection and are not able to mobilise or manoeuvre themselves on their own. You need to notice this and adapt to the care that they need now. So they need to be turned. Their heels need to be floated if they are not able to manoeuvre themselves to prevent pressure areas from developing. Each time you move or manoeuvre a resident, you should note the colour of the skin and note the small little changes. Encourage and communicate with the care assistants as to whether or not they have noticed any changes on the resident's skin, and adapt and change the nursing care plan as required. Restraints. Restraints is seen as restrictive practices towards residents. For instance, bed rails. Here at Escaree, we are currently a restraint-free environment. To achieve this, we risk assess each resident individually, and we utilise equipment such as low beds, crash mattresses, in order to ensure best practice at all times. It is vital to get to know the individual resident, knowing their wishes and preferences for when it is end of life. Each resident's spiritual beliefs and religious values may be different. Knowing their wishes and where they are wrote down, you will understand and be able to follow through on their wishes as they requested. Dealing with family members. Here in Escaree, we have next of kin first contact. This is the person that you will contact where there is any change or deterioration in a resident's condition. It can be as simple as a resident having a urinary tract infection, or to a resident having become very unwell and requiring transfer to an acute setting. It is vital at all times that there is good, clear communication with the next of kin. It is also vital that you document the conversation that you will be having with the next of kin and the content in which was undertaken. I expect all staff to be professional at all times. Within Escaree, we are an English-speaking company, and it is vital that all employees use the English language at all times when communicating with each other and with family members. If at any point you have difficulty understanding or comprehending something that has been said in the English language, you can come to either the CNMs or myself, and we will try our utmost to ensure that we can explain it in a different way so that you can understand it better. It is important that at all times your uniform is neat and tidy and you are presented in a professional manner at work. It is expected that you will change into and out of your uniform before and after you're off duty. It is also of vital importance, and for infection control reasons, that you would change into and out of uniform, pre and post duty. It is important at all times to have a positive attitude within a school. This helps in all forms of communication between your colleagues, your residents. It is of great benefit to your residents and to your colleagues. Every day is a learning day here in Escurry.